13 can be a lucky number. There are 13 essential vitamins consisting of vitamin A, vitamin B group, vitamin C, and vitamins D, E, and K. Vitamins are simply nutrients of various types needed by the human body to maintain good health and are present to a varying degree in common food groups. Vitamin supplements are drugs developed to make up for the problems in dietary intakes that result in temporary or permanent vitamin deficiencies. Although it's obvious today for the general public to associate vitamin supplement consumptions with everything from prevention of cancer and heart disease to perpetual youth, there are many misconceptions needing clarification through the proper government regulatory agencies. There are serious health problems that may develop from general misunderstanding and misleading advertising associated with the retail sales of vitamin supplements. We definitely need improved education of the public and more stringent regulations of advertising materials by the appropriate federal and state agencies. To try to give you a better understanding, I will first discuss some facts on vitamin supplements. Next, describe damaging effects, and finally, identify solutions in making our lives safer. Vitamins is one of the most essential nutrients required by the body and can be classified in two broad categories, namely water-soluble vitamins and fat-soluble vitamins. Water-soluble vitamins are vitamin B group and vitamin C. These vitamins need daily replacement because they are lost in body fluids such as sweat and urine. The overdosage of water-soluble vitamins in most cases is generally just a waste of money. Fat solubles are vitamins A, D, E, and K. Fat soluble vitamins dissolve in fat, and since fat stores better than water, it is less critical when the intake of these vitamins is interrupted than when water soluble vitamins are interrupted. However, when extreme amounts of these vitamins are taken, toxic levels can become present in the body. The important issue for these organic chemicals is that normal diets and otherwise healthy individuals provide enough of the necessary nutrients. An article written in Bupa Health on October 11, 2004 listed exceptions where vitamin supplements are desirable and often necessary to prevent diseases. These exceptions include pregnant women, children, elderly people with limited exercise or appetite, people recovering from some surgeries, strict vegetarians, alcoholics, chronically ill patients, and anyone else with special circumstances affecting health or diet. The science is clear that there are risks in taking megadoses of vitamin supplements. Physicians and chemists now know the required amounts for various vitamins as well as the risk associated with overuse. According to March 2007 article from Johns Hopkins Medicine, too much vitamin A may interfere with the bone formation and increase the risk of fracture. Additionally, an article from Bupa Health on October the 11th, 2004 notes that high doses of vitamin C over long periods of time can lead to side effects of diarrhea, stomach pain, and disease of kidney, heart, liver, and skin. Unlike other vitamins and minerals, the body can manufacture vitamin D in response to small amounts of sunlight. Vitamin D is found in dairy products to provide most people with more than the required amounts for good health. Yet, this vitamin is one of the most frequently used in large quantities. The science suggests that 400 units a day of vitamin D is efficient for most people. However, over-the-counter drugs are available that recommend 1,000 units or more to people who simply aren't informed that doses above 2,000 units a day can become toxic over time. While toxic levels vary for individuals, vitamin D is considered toxic to infants in doses as small as 15 milligrams. On January the 20th of 2007, the National Health Federation notes that in 1998 there were 49,709 incidents of vitamin toxics reported to poison control centers throughout the country. And since poison control centers rarely deal with chronic issues, we may assume that the majority, if not all, of these cases involve the ingestion of excessive amounts of vitamin over relatively short intervals. Now that you realize that vitamin overdose leads to serious problems, let's discuss some solutions. There are many examples, but the general point, not known by many in the general population, is that most people don't require vitamin supplements, and those that do take them need to know the safe dosage levels, expected benefits, if any, and health risk associated with excess consumption. Improving education to the public and more stringent regulations of advertising materials for the appropriate federal and state agencies are ways to prevent these conditions. By the FDA regulating dietary supplements as drugs and not food, the FDA, not the manufacturers, would review the safety of the dietary supplements and approve them before they are marketed to the consumer. The vitamin supplements would then be required to list potential side effects on their labels. The supplement labels could not make claims of safety without scientific evidence. The industry would be required to report to the FDA all serious dietary supplement-related adverse events. Clearly, vitamins are vital to good health, and vitamin supplements are necessary in some circumstances. However, something else is needed. Further regulation of advertising and labeling is essential to avoid health problems and even death caused by overdoses. There are no fountain of youth, and those that seek it by taking large amounts of vitamins are risking the end of life rather than the continuance. Write your senators and representatives, email them, call them on the phone. Become active in a plan to acquaint your elected representatives with the benefits of vitamin supplements, along with the tremendous risk caused by the illegitimate claims and false advertisements currently ignored by the FDA and governmental regulatory agencies.